Hi, I'm Kalyan Siddam. Joining with me today, Tressa Springmann, SVP and CIO at LifeBridge Health, and Mike Hardesty, IT Security Analyst at LifeBridge Health. Tressa is a thought leader and an active voice on several information security organizations at CRISP and Chime, while Mike is a practitioner who is intimately aware of the challenges in securing the IT and IoT devices, specifically in the healthcare industry. Hey Tressa, hey Mike, thanks for your time. So Tressa, considering the recent onslaught of cybersecurity attacks on healthcare industry, could you talk about the security strategy at LifeBridge Health to offer continued care and the role of latest technologies like machine learning to address these security challenges?
Great, thank you. Well, strategy is a broad word. We have very much been mindful for years of the HIPAA requirements, but certainly with the continued automation in the healthcare space, the need for more rigor around information security is paramount, and have been looking most recently at the NIST framework. So when we talk about planning in a framework, we actually are just concluding a very broad security risk assessment, and that is translating into a 3-year action plan. That strategy not only includes tools, but it includes the necessary workforce development and education around security that we all realize, especially recently, is such an essential vulnerability that we have in our organization and something that's controllable. In addition to tools and workforce management, the policy and procedure and administrative requirements of our plan are also incredibly important. And although by regulation we need to make sure we have these policies in place, we all recognize that having very effective procedures to protect us and to assist with the controls around the vulnerability of our information technology environment are essential. So I guess to summarize, apologies for being long-winded, but we really look at our strategy not only being our tools, but our people, our processes, our technologies themselves in a very broad way. Most recently, they've been very informed and influenced by a lot of the kind of breach and bad guy foreign activity that we've seen, very sadly, as well as the development of the intelligence around medical devices and how our information technology network is no longer just the things that we're used to in terms of computing devices in a traditional sense.
Could you elaborate a little bit more about the biomedical device visibility and security within the broad security strategy that you talked about?
Sure. Well, biomedical devices are very unique to a healthcare setting. And for years, biomedical devices, while they had some intelligence, they weren't connected to our network. So they weren't really part of the IT infrastructure that we look at and really focus on from a protective perspective. But over the last few years, more and more of these devices are becoming what we call smart devices, and they become connected to our network. They have to share or exchange data with other systems. And so really from a network perspective, they're just another endpoint. Yeah. So another vulnerability. Mm-hmm. And yet they act very differently, they behave very differently, and sometimes they're a little more complex to manage than just the traditional computing devices, because many times they're third-party purchased, there are other vendors involved, and frankly, many of them are connected to patients. Yes. And so there's another level of vulnerability that we need to be especially sensitive to.
Okay. So considering the backdrop of this connected medical device and how unique challenges that they pose, obviously they're adding additional value being connected. Where do you see in terms of operationally within your teams, and as well as especially when you look at multiple hospitals that you have in your system,
sure,
how you are able to kind of execute on this strategy?
Sure. Well, we're learning quite a bit, and I'd be misleading if I'd say we're not there, if I said we were there yet. And what do I mean by that? even the traditional information technology tools that we have employed don't necessarily take into account some of the nuance that having these clinical or biomedical devices on the network require. And so very recently, there are new tools that have moved into this space that really give us much better visibility and management capability about the unique types of these devices. So, the security team has to take a look at those tools and understand how do they fit with the portfolio of tools we already have. How do we make sure that we're maximizing our investment, but we're still getting visibility to the endpoint, whether it's, and just simply put, the inventory that we need to have visibility to when the device comes into the organization, gets connected to the network, is monitored, or even is discontinued or retired. That inventory is now much more complicated because we have this whole other set of devices that in many organizations come into the organization through a whole different logistical structure. Yeah. And frankly, they typically don't sit on people's desks. They sit in patient rooms, and they can be connected to patients. Yeah. So whether it's inventory management, patch management, device management, upgrade control, change management, it adds a lot of layers of complexity. Not to say it already wasn't a little bit difficult in terms of patch management and endpoint management, but this adds a whole nother layer of difficulty that we're leaning into, so to speak.
Thank you. I think you touched on a very important aspect about IoT device lifecycle management. So maybe I'll take that question to you, Mike. From a tools point of view, considering you have the guidance and strategy overall, and also the problems that are faced in the not only just for your LifeBridge system, health system, but as well as in the industry, could you please maybe talk about what you are doing in terms of trying to cope with those challenges and execute on those in securing these connected devices?
Sure. So one of the tasks that I'm tasked with by Tressa and all of our organization is to keep our data secure and to find out what's going on the network. And one of my primary job duties is to manage our SIM tool. And as a security analyst, we love information. Anything that's usable, I like to ingest into that tool. And one of the products that we are evaluating currently allows, basically will fingerprint all of the devices on the network and tell us what it might be, the vendor, what it's doing on the network, who is it communicating to, and how much data is it sending out and to whom. I recently integrated this product into our SIM tool. It was very easy to do so, and the value that it gives us is it enriches all of my current data that I'm already ingesting in from our Active Directory, from our VDI devices, from our remote connectivity solutions, to even our web gateways. So in the event that we do have an offense or a breach, I can go back and look at everything to get that whole picture of what actually happened on our network or what is going on. And then we can either shut it down if it's an issue, or we can look back and say, hey, this is actually behaving as normal, and write off and say, hey, this is good.
Okay, thank you. Could you also talk about, considering these long life cycles of these connected medical devices, you may not have certain patches for known vulnerabilities immediately available. Could you talk about how you're trying to look at protecting these devices as well?
Sure. So sometimes, obviously, you can't patch, or for whatever reason, you may not have the budget to upgrade a thing right away, and you still have to use these devices for patient care. So some of the things that we can do, or tips and tricks in the trade, is maybe isolate that device to its own VLAN, push some access control lists around what that device can communicate to. Say, if it's an IV pump, maybe it can only talk to the IV pump server and vice versa. So it doesn't need to talk out to the entire internet. Those are some of the things that we're putting in place.
Tressa, I know industry is going a lot of changes here, especially in the LifeBridge systems. You may be looking to do a lot of merger and acquisition. Could you comment about how that is adding to this challenge about securing the connected medical device and continuum care?
There are a tremendous amount of mergers and acquisitions right now in our industry, and LifeBridge is no different. We've had many of them in the last couple of years. And aside from due diligence, where we do assess the cyber and the IT vulnerability of these organizations, the minute they become part of LifeBridge Health, We are now owners of that risk. And so ensuring that our plan, as we onboard these organizations, surfaces the highest risk areas so that we can start addressing them, is something that's very critical to the plan. But from our tools, what is equally important is not to create a cumbersome monitoring and controls environment for our security staff. It's hard enough to have visibility to all of our endpoints already without complicating it by multiple tools and not addressing it in an enterprise fashion, with really trying to have the fewest tools but providing the highest level of visibility and the highest capability of surfacing what real threats are across this expanded IT environment.
Tressa, one of the things you mentioned about in the challenges and opportunities as you're onboarding new hospital systems into your network is that you may have certain lessons learned and best practices that you could easily want to replicate across multiple hospitals that you're onboarding. And as well as one of the challenges that I think is faced in the industry is that the sources of information that you have could be spread across multiple teams, right? Could you talk a little bit about that?
Oh, absolutely. To your point, the complexity gets compounded when you have layers of people and tools and policies. And very much we're beginning to see and are very excited to see the industry have awareness that a siloed set of individual tools really is not where we need to land. What we really need is an enterprise platform that allows our security team to have visibility and the ability to synthesize all of the data from those endpoints and connections to be managed more comprehensively. And, I think it's just a maturity in this space. It's a maturity in the set of infrastructure tools. Back in the day, the analogy I would use is when we started automating hospitals, we'd put in a lab system and a pharmacy system and a registration system. And as we've matured, we've recognized that having a fully integrated platform starts bringing much more value to a clinician. The analogy here would be the same. I think as we see our infrastructure and security and monitoring and detection tools mature, I would hope that we're going to see some enterprise platforms that allow for the ability for a little bit more plug and play so that our teams have a comprehensive look and an ability to manage all the threats in a comprehensive way so that it's not taking us months to figure out how to onboard new skills, new tools to get that same visibility.
Okay. Thank you. I think in closing, do you have any comments, Tressa, that you want to make broadly in terms of LifeBridge as a healthcare service provider and as well as the industry in terms of taking the lessons learned and applying across your hospital system and as well as some things that you could probably share with your peers in the industry?
Sure, thank you. All healthcare organizations have a mission and a commitment to serving their communities, and LifeBridge is no different. As a CIO, I have a responsibility to advance and protect the information assets around the patients that we serve and the employees in our organization. And no surprise, it's not getting any easier. It's getting much more complex. I'm really thrilled with some of the new tools that are coming in on the market. I hope that the economics of them are in line with our ability to protect our information technology assets to the extent that our budgets afford and that the industry makes available. We're starting to see a lot of fantastic opportunities and tools, and it's not going to get any easier. Like anything else, the more we automate, the more complex it will be, and probably the more of my time and the time of my peers in our role and our budgets will have to be spent on not just advancing the automation in the healthcare space, but certainly protecting it.
thanks for watching. It was great to have Tressa Springmann of LifeBridge Systems and Mike Hardesty with me to talk about some of the challenges that they are seeing in both LifeBridge security as well as within the industry.
Thank you.
you.
Thanks for having us.